Hello everyone, this is Miss Gibson. This is lecture 1 over cancer. It is just an overview of cancer and treatment options. Here are your objectives. I'll let you look through those. And here is just from 2020 to 2025. Cancer is the second leading cause of death in the United States, second to heart disease. We know as a nurse, one vital role will be educating on risk, preventions, screenings, and treatment. And this is chapter 18 in your Med-Surg book. Starts on page 375. This just gives you the totals as of 2024 for each of these cancers. This gives you the incident and mortality rates among states. Pathophysiology, many body cells continue to grow by mitosis or cell division long after maturation. On page 376, your book gives the definition of cancer, also called malignancy, is a type of abnormal cell growth in which cellular regulation is lost, resulting in new tissues that serve no useful function, are harmful to the function of normal cells and organs, and can lead to death if left untreated. It is a common disease worldwide, although the types of cancers vary with a country's affluence. Each year, about 1.9 million people in the United States and 220,000 people in Canada are newly diagnosed with cancer. So many body cells continue to grow by mitosis or this cell division. Some tissue and organs stop growing by cell division after development is complete. They're replaced with scar tissue, such as your heart muscle cells, skeletal and skeletal muscles, as well as neurons. Some key terms here: hypertrophy. It's a growth that causes cell tissue to increase in size by enlarging each cell. You also have hyperplasia, which is growth that causes tissue to increase in size by increasing number of cells. And then neoplasia. This is the growth, new or continued growth not needed for normal development or replacement of dead or damaged tissues. This growth is always abnormal, even if it causes no harm. So that's really important to know. Next, we're going to talk about biology of a normal cell. This is just kind of an overview. Many cells work together to make the whole person function at an optimal level. Each cell must perform in a predictable manner. You have specific morphology. This is each cell type has a distinct and recognizable appearance, size, and shape. Smaller, smaller nuclear to cytoplasmic ratio is the size of normal cell nucleus is small compared to the size of the rest of the body. The rest of the cell, including the cytoplasma. Then you have differential function. Every normal cell has at least one function to contribute to the whole body function. Skin cells make keratin, liver cells make bile, RBCs make hemoglobin are some examples. Tight adherence, you have normal cells make proteins, that protrude from membranes and allow cells to bind closely and tightly together. Exception is blood cells. Non-migratory, these normal cells do not wander through the body except blood cells due to being tightly bound together. Orderly and well-regulated growth or cellular regulation. This is where mitosis takes place for two reasons: to develop normal tissue or to replace lost or damaged normal tissue. This occurs in a well-recognized pattern by the cell cycle. Cellular regulation of division is a balance between the proteins that promote cell division and the proteins that limit cell division. Then you have contact inhibition. This stops further rounds of cell division when the dividing cell is completely surrounded and touched or contacted by other cells. Can only divide when some of the surface is not in direct contact with another cell. Next, you have apoptosis, which is programmed cell death. The cell has to die at the appropriate time. Normal cells have a finite lifespan. And then normal chromosomes, each cell has 23 pairs of chromosomes. Next, we're going to talk about biology of an abnormal cell. The specific morphology look like tissues that they come from. They retain a specific morphology of the parent cell. Benign tumor cells, these are normal cells growing in the wrong place or at the wrong time as a result of a small problem with cellular regulation. Some examples would be moles, nasal polyps, or endometriosis. And cellular regulation is discussed on page 377. Smaller nuclear to cytoplasmic ratio. That is just like the normal cells. Specific differentiated functions continue to be performed by benign cells, such as in endometriosis. The normal lining of the uterus grows in an abnormal place, such as on the ovary, but acts just like the normal endometrium by shedding each month under influence of estrogen. Then you have tight adherence, where it continues to bind to each other by producing fibronectin. No migration or wandering. They remain tightly bounded and do not invade other tissues. Orderly growth. Normal growth patterns occur even though their growth is not needed. Growth beyond appropriate time and in the wrong place indicates some problem with cellular recognition. Cellular regulation. Too many words. And then normal chromosomes, you usually have 23 pair of chromosomes with few exceptions. Now we're going to talk about malignancy. So, biology of an abnormal cell. First, we have anaplasia. This is a loss of specific appearance of parent cell as it becomes more malignant. It becomes smaller and rounded. Thus, under microscope, many types look alike. Larger nuclear to cytoplasmic ratio. The nucleus occupies much more space than in a normal cell, especially during mitosis. Specific function partially or completely lost. Cancer cell serves no useful purpose. There is loose adherence. They do not make fibronectin, thus easily breaks from main tumor. Migration occurs because cancer cells do not bind tightly together, allow cells to slip through blood vessel walls and tissues, spreading to other parts of the body, which is metastasis, which is unique to cancer and major cause of death. Contact inhibition does not occur because loss of cellular regulation. Persistent cell division, even with contact on all sides. This persistence makes cancer hard to manage. Rapid or continuous cell division occurs because cancer cells re-enter cell cycle for mitosis almost continuously because cell regulation is lost. Cells do not respond to apoptic signals and have unlimited lifespan. They're immortal. Abnormal chromosomes, number and structures are not normal chromosomes, are lost, gained, broken, or rearranged. May have less or more than the normal 23 pairs. So next, this picture just shows a picture of benign, how the tumor cells grow only locally and cannot spread by invasion or metastasis. Over here is your malignant cancer cells. They invade neighboring tissues, enter the bloodstream, and metastasize to different areas. This is a YouTube video that goes over that you can watch. Next, we have cancer development. This is carcinogenesis. This is where cancer cells lose all differentiation and function. They do not respond to normal cell death and immune surveillance for destruction. This overgrowth causes significant illness, complications, and death from cancer. Carcinogenesis is the process of changing a normal cell into a cancer cell. The process occurs through loss of cellular regulation, leading to the steps of initiation, promotion, progression, as well as metastasis. Initiation is the first step in carcinogenesis. Normal cells can become cancer cells if they lose cellular regulation. Initiation is an irreversible event that can lead to cancer development. Substances that change the activity of a cell's gene so that the cell becomes cancerous are carcinogens. Carcinogens may be chemical, physical agents, or viruses. More than 248 agents, substances, mixtures, and exposures are expected to be carcinogens or known to cause cancer in humans. The next step is promotion. Promotion is the enhanced growth of an initiated cell by substances known as promoters. Once a normal cell has been initiated by a carcinogen and is a cancer cell, it can become a tumor if its growth is enhanced. Many normal hormones and body proteins, such as insulin and estrogen, can act as promoters and make cells divide frequently. The time between a cell's initiation and the development of an overt tumor is called the latency period, which can range from months to years. Exposure to promoters can shorten the latency period. Next, we have progression. Progression is the continued change of a cancer cell, making it more malignant over time. After cancer cells have grown to the point that a detectable tumor is formed, the tumor can start to develop its own blood supply, ensuring its continued nourishment and growth. As tumor cells continue to divide, some of the new cells undergo genetic mutation that changed features from the original cancer cell. Over time, the tumor cells have fewer and fewer cell features. The original group of cancer cells or tumors caused by carcinogenesis is called the primary tumor. It is usually identified by the tissue for which it arose, or the parent tissue, such as in breast cancer or lung cancer. Metastasis occurs when cancer cells move from the primary location by breaking off from the original tumor and establishing remote tumors. These additional tumors are called metastatic tumors. Even though the tumor is now in another organ, it is still a cancer from the original tissue. For example, when breast cancer spreads to the lung and the bones, it is still breast cancer in the lung and bone, not lung cancer, not bone cancer. Metastasis occurs through many steps, which is shown in figure 18.2. There's another YouTube video that you need to watch that will help kind of solidify the information that I've been giving you. The next slide, this is selected sites of new cancer cases and deaths for the United States. This is as of 2020. Cancer classification, this is classified by type of tissue, biological behavior, anatomical site, and degree of differentiation. There are about 100 different types. Cancers are classified as either solid or hematologic. Solid development from specific tissue, such as the breast or the lungs. Hematologic arise from blood cells forming tissues. So, cancer grading. Systems of grading and staging have been developed to help standardize cancer diagnosis, prognosis, as well as treatment. Grading determines how similar that cancer cell looks to the parent cells. Some cancer cells barely resemble the mature tissue from which they arose, are aggressive, or spread rapidly. These cells are a high-grade cancer. Cancer cells that are well differentiated and more closely resemble the tissue from which they arose are generally less aggressive. It is a means of evaluating the patient with cancer for prognosis and appropriate therapy. So, grading just classifies the cellular aspects of cancer, compares cancer cells to normal parent cells by tissue and cell appearance or activity. Plotigy, this classifies the number and structures of chromosomes as normal or abnormal. Staging classifies the clinical aspects of cancer, determines exact location and the degree of its metastasis at diagnosis. So, clinical staging, this assesses patient symptoms, evaluates tumor size and possible spread. Surgical staging is where they will assess the tumor size, the number of sites spread by surgical inspection. Pathologic staging, this is the most definite. They will remove a piece of the tumor and send it off to pathology to examine it to see what type of cancer it is. So next is tumor node metastasis system. This is a system used to describe anatomical extent of cancer. It's a staging system that has specific prognosis value for each solid tumor type. It is not useful for leukemia or lymphoma. The tumor growth, the amount of time it takes for a tumor to divide to double in size is called doubling time. And then the meiotic index, this is the percentage of actively dividing cells within a tumor. And then if you look on page 379, it will discuss the cancer grading and staging. And then there's also a table, 18.4, that will tell you classifications of tumors by tissue of origin. So that's a couple different things for you guys to look at. Cancer, etiology, and genetic risk. There's three interacting factors that influence cancer development. That is exposure to carcinogens, genetic predisposition, and immune function. These factors account for variation in cancer development from one person to another, even when each person is exposed to the same hazard. Oncogene activation. This is the main mechanism of carcinogenesis regardless of specific cause. These oncogenes are turned on or expressed under controlled conditions for cellular regulation. Other times they are turned off, controlled, or suppressed by products of suppressor genes. Oncogenes are part of every cell's normal makeup. They become a problem only when they are overexpressed as a result of exposure to carcinogenic agents or events with loss of cellular regulation. External factors causing cancer. So external causative factors are responsible for 80% of cancers. You have chemical carcinogenesis, which can occur from exposures to many known chemicals, drugs, or other products used in everyday life. Chemicals vary in how carcinogenic they are. For these substances, chronic long-term exposure to large amounts is required before cellular regulation is lost and cancer develops. Physical carcinogenesis, this is from physical agents or events also causes cancer by DNA damage. Both ionizing and UV radiation can cause cancer. Some ionizing radiation is found naturally in radon, urium, and radon, which is found in rocks and soil. Other sources of ionizing radiation include X-ray for diagnosis and treatment of disease, as well as environmental radiation. Then you have viral carcinogenesis, which occurs when viruses infect body cells and break DNA strands. Viruses then insert their own genetic material into the human DNA. Breaking the DNA along with viral gene insertion mutates the cell's DNAs. Dietary factors related to cancer are poorly understood but are suspected to increase cancer risk. Suspected dietary factors include a low fiber intake, a high intake of red meat or animal fat, preservatives, preparation methods, and additives such as dyes, flavoring, or sweeteners may have cancer promoting effects. Personal factors in cancer development. Personal factors in cancer development. Immunity protects the body from foreign invaders and non-self cells. Cancer incidence increases among immunosuppressed individuals, 60 years or older, AIDS patients, transplant or immunosuppressant therapy. Advancing age, as a person ages, immune protection decreases. External exposure to carcinogen accumulates. Genetics, such as breast, skin, colon cancer, all show genetic links. Down syndrome increases their risk for acute leukemia. Medications and hormones. Long-term estrogen therapy linked to breast, uterine, ovarian, cervical, and vaginal cancers. DES was used in the 1940s and 70s to prevent miscarriage. Children of mothers who took the drug are at an increased risk for reproductive cancers. 7 warning signs of cancer, which is caution. You have changes in bowel and bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening or lump in the breast or elsewhere, indigestion or difficulty swallowing, obvious change in a wart or mole, nagging cough, or hoarseness. There is genetic testing that's available to confirm or rule out a person's genetic risk for certain cancer types. It does not diagnose cancer, only provides risk information. When a patient does test positive, their risk for cancer development is greatly increased. However, the cancer may never develop. So now we have cancer prevention. The first one is primary. Primary prevention is avoidance of known or potential carcinogens in an effective prevention strategy when a cause of cancer is known and avoidance is easily accomplished. For example, teach adults to use skin protectant during skin exposure to avoid skin cancer. Most lung cancer can be avoided by not using tobacco and eliminating exposure to asbestos particles. Teach all adults about the dangers of cigarette smoking and other forms of tobacco use. Teach adults who are exposed to carcinogens in the workplace to use personal protective equipment that reduces direct contact with these substances. As more cancer cases are identified, avoidance may become even more effective. Now, next we have modifying associated risk. This has a positive influence in reducing cancer risk. Absolute cause of cancer is not known. Examples of that are increased incidence of cancer among adults who consume alcohol. Removal of at-risk tissue reduces cancer risk for an adult who has a known high risk for developing a specific type of cancer. Examples include removing moles to prevent conversion to skin cancer, removing colon polyps to prevent colon cancer, and removing breasts to prevent breast cancer. Chemoprevention is a strategy that uses drugs, chemicals, and natural nutrients or other substances to disrupt one or more steps important to cancer development. These agents may be able to reverse existing gene damage or halt the progression of the transformation process. The use of tamifloxine to reduce the risk for breast cancer is an example. Vaccination is a method of primary cancer prevention. Currently, the only vaccines approved for cancer prevention are related to the prevention of infections from several forms of human papilloma virus, or HPV. As more cancer-causing organisms are identified, the hope is that vaccines will be developed to prevent those infections. Secondary prevention, you're looking at use of regular screenings for cancer. You want to teach all patients of the benefits of participating in specific routine screening techniques. Examples would include the choice of annual mammography for women 40 to 44 years of age, annual or biannual mammograms for women older than 55 years, fecal occult blood test or colonoscopy for adults starting at age 45, and then cervical screening starting age 25. Consequences of cancer. Cancer can develop in any organ or tissue and destroy normal tissue, which increases its function. It can cause death by metastasizing into vital organs and disrupting critical physiological processes. Impaired immunity and clotting. When cancer starts invading bone marrow where blood cells are formed, this results in reduced production and function of healthy white blood cells, Leukemia increases risk for infection. Bone marrow invasion by cancer cells results in anemia and thrombocytopenia, resulting in impaired clotting. So your altered GI functions, tumors in the GI tract increase metabolic rate and nutrient needs for disease treatment and treatment-related appetite loss and loss of taste resulting in weight loss. Cachexia, this is extreme body wasting and malnutrition. Early satiety, which is just a sense of being full. Altered peripheral nerve. Let me go back. So sorry. Yes, so altered nerve function may be from tumors in the spine, more common in chemotherapy patients. So you have motor and sensory deficits. This is just perception deficits occur when tumors invade bone and brain. It compresses on nerves. Then you have cancer pain. This does not always accompany cancer, can be a major problem, especially if it's chronic pain. Then altered respiratory and cardiac function. Cancer can disrupt respiratory function, capacity, as well as gas exchange, leading to death. Common diagnostic tests, you have biopsies. This is the removal of a small piece of living tissue from an organ or other body part for a microscopic exam. You have endoscopes. This is use of rigid or flexible tube that has a magnifying lens, light, camera. They also have suctioning. X-rays may identify tumors. Chest X-ray would confirm lung or thoracic structures. Mammogram for breast. GI series. A barium enema can be used for the lower GI. And then an IVP for kidneys, bladder, and ureters. Also have bone scans to detect metastasis tumors, to detect malignant tumors capable of metastasis to the bone, breast, kidneys, lung, prostate, thyroid gland, and bladder. CT scans visualize structure in planes, so especially good for small lesions. You have ultrasounds next, which uses sound waves to detect tumors. PET scans or PET scans, this is an imaging test that uses a radioactive substance called a tracer to look for disease in the body. As the patient goes through the PET machine, the machine will light up, which shows cancerous cells. MRI is no radiation. It's a powerful magnet. Must be aware of contraindications such as a pacemaker, metal plates, sharpener, or screws that might be inside the patient's body. Radioisotopes, this is an injection or ingestion of a radioactive substance. Then a scanner runs over the body to trace areas of the substances accumulated, generally indicates a tumor. And then you have lab tests. You have a CEA, which is a carcinoembryonic antigen, which would detect colorectal, stomach, pancreas, prostate, lungs, and breast cancer. You have a PSA, which is the to test for prostate cancer. You have AVP, which is alpha fetoprotein, a test for liver, testicular, and breast. You have CA125, that'll test for ovarian cancer. CA5-3 and CA2729 will test for advanced breast cancer. Now, cancer management, you can have prophylactic, diagnostic, curative, cytoreductive, palliative, second look, or reconstructive. With surgery, this is for diagnosis or management, earliest known treatment for cancer. Then you're going to have diagnostic. This is remove all or part of suspected lesion for examination. Curative, remove all of cancerous tissues. Cures, most effective is small, non-invasive skin cancer, such as basal cell. Cancer control or cytoreductive surgery. This removes part of but not all of the tumor. Debulking surgery decreases the size and number of cells to alleviate symptoms, enhance other treatments, and can increase survival rate. Palliative or palliative surgery. This is just for symptom relief and to increase quality of life, but not a cure. Reconstructive or rehabilitative surgery. This increases function or enhances appearance of both breast, esophageal reconstruction, bowel reconstruction, cosmetic head or neck reconstruction. Some side effects of some of these would be loss of body part or function, scarring, disfigurement. Next, we're going to talk about teletherapy. This is also known as radiotherapy. It's high energy radiation from gamma rays or ionizing radiation beams to kill cancer cells, provide disease control, or relieve symptoms. There's minimum damage to surrounding tissue. Hair loss and skin changes occur only at the site. Newer methods have precise delivery of higher doses and spare the surrounding tissues. Cells damaged by radiation either die outright or become unable to divide. Let's see. And then you do also have external beam teletherapy. This is delivered by source outside of the patient. Thus, patient is not radioactive and no harm to others. Internal device or brachytherapy depends on type, size, tumor location, and the general health of the patient. Radiation has direct, continuous contact with tumors for specific time. Radioactive isotopes either in solid form or within body fluids. The radioactive source is within the patient. Patient emits radiation for a period of time and is a potential hazard to others. So this is just talking about cancer management, chemotherapy, cytotoxic symptom therapy or chemotherapy. This is this is chemotherapy medicine, drugs to kill cancer cells and disrupt cellular regulation. Used when cancer has spread beyond a localized area that can be removed with surgery or treated with radiation. Unlike other therapies, it does kill cancer cells as well as normal cells throughout the body. Chemotherapy, it is a treatment of cancer with chemical agents used to cure or to increase survival times. Side effects of chemotherapy, so you have bone marrow suppression. You can have things like anemia, neutropenia, thrombocytopenia. This is all because of how it suppresses the bone marrow. You can have chemotherapy-induced nausea and vomiting, which you'll just treat with an antiemetic before chemo routine and as needed. Mucocytosis, this is sores in the mucous membrane, especially in the mouth. Could have things like stomatitis, which involves other tissues in the oral cavity. You just want to provide education on oral hygiene. Alopecia, this is hair loss, may occur anywhere on the body. It's usually temporary. New hair could change color, thickness, or texture, though. Changes in cognitive function, just reduced ability to concentrate, could have memory loss or difficulty learning new information. Chemotherapy-induced peripheral neuropathy. This is loss of sensory or motor function of peripheral nerves. They'll have loss of sensation in hands and feet, orthostatic hypotension, erectile dysfunction, as well as pain. Next is oncologic emergencies. Sepsis, which we know what sepsis is, it's a condition where organisms enter the bloodstream, can result in septic shock. They're at an increased risk due to low white blood cell counts and impaired immune function. The disseminated intravascular coagulation, this is a problem with blood clotting processes causing excessive bleeding from many sites, which decreases the blood flow to organs. Prevention is key. You're going to identify patients at risk and teaching to avoid infection, good hand hygiene, that kind of thing. Next, we have syndrome of inappropriate antidiuretic hormone. This is induces ADH secretion from the posterior pituitary when not needed by the body. Water is reabsorbed in excess by kidneys and put into systematic circulation. It causes weakness, muscle cramps, loss of appetite, fatigue, hyponatremia, confusion. Then you have spinal cord compression. This damage occurs either when a tumor directly enters the spinal cord or column, or when the vertebrae collapse from tumor degradation of the bone. Hypercalcemia, this is increased serum calcium levels. High levels are an emergency and can lead to death. You could have skeletal pain, kidney stones, abdominal discomfort. Treatment is oral hydration or IV hydration, loop diuretics, which promote calcium loss in urine. The superior vena cava syndrome, this is compression or obstruction of the superior vena cava, which returns blood from the cranial, neck, and upper extremities to the vasculature of the heart. It could lead to clots in the vessels, which leads to congestion of the blood. Early signs of this would be edema of the face, eyes, tightness of shirt or neck, tightness or shirt or blouse collar being too tight around the neck, engorged blood vessels, edema in arms and legs, and dyspnea and epistaxis. Treatment is high-dose radiation, chemotherapy, surgery, or stent placement in the superior vena cava. Last is tumor lysis syndrome. This is where large numbers of tumor cells are destroyed rapidly. Positive sign that treatment is working. It can be severe untreated. If untreated, can cause tissue damage, acute kidney failure, and or death. It can cause hyperkalemia, which can cause some cardiac dysrhythmias. If large numbers of purines enter the cell from tumor lysis syndrome, you want to hydrate the patient. They may be given diuretics and drugs to promote purine excretion, such as allopurinol. Please make sure you know and understand each of those emergency that definitions that we just discussed. And that is it. I know it's a lot, but if you have any questions, don't hesitate to reach out. Shoot me a quick email. Thank you.